When your child has an epileptic attack, here are the do's and don'ts. In case of emergency, stay calm and act sensibly so that on-site management and first aid can be given appropriately. Here are the things to do when a child has a seizure. First and foremost, stay calm. Stay with your child. If possible, note the time the seizure starts and when it ends. Loosen tight clothing. Roll your child onto his side into the recovery position. Then move your child away from potentially harmful objects such as furniture with sharp corners, water or fire sources. Place something soft under your child's head to stop their head from hitting the floor. Wipe off any secretions that may come from the nose or the mouth of the child. Here are also a list of things that you should avoid doing in a seizure emergency. Please do not panic. Do not try to hold or restrain your child forcibly. Do not put anything in your child's mouth. Do not try to forcibly open your child's mouth, especially by putting your fingers. Do not try to give your child medicines orally. Do not try calling your doctor, as he or she may not always be available for your help. Instead, go to the nearest emergency clinic. An infographic can also be downloaded and printed from the Nayi Disha Resource Center website for easy reference of the do's and don'ts of seizure first aid. Rescue treatment can be administered in the form of nasal medications, such as using the Midazolam nasal spray. Nasal rescue medications are not an alternate to daily seizure medications. They are often used to stop seizures as emergency intervention.
We do not require spray for a shorter seizure, but for something which goes on for more than 5 minutes, yes, as a first aid, we should administer a Midazolam spray.
These nasal medications can be administered with the following guidelines. First, clean the nose. Hold the medication in your hand well. Now hold the patient slightly upright. Spray the medication once or twice in the air. Place the tip of the nozzle inside the nostril of the child. Count and spray the medication as per the dose advised to you. Here are also a list of guidelines to help parents understand when they need to take their child to the hospital right after a seizure. You should take your child to the hospital after a seizure under the following circumstances. If this is your child's first seizure, if the seizure duration is more than 5 minutes long, if the child is experiencing any form of breathing difficulty, if the child appears blue around the lips, if you are unsure that your child is well and recovering normally after a seizure.
Even after giving a single medication or a dose of benzodiazepine, if the seizure is not controlled, the chances of seizure going into a prolonged phase, or what we call it as a status epilepticus, are much higher. So in that situation, to avoid further complications, the parent should rush the child to the nearest medical facility. It may not be appropriate medical facility, it could be any nearest facility where injectable anti-seizure medication can be administered.
The first aid video for epilepsy addresses common guidelines for first aid. It provides a step-by-step methodology to help parents distinguish a regular seizure episode from a major emergency, along with guidelines for using the Midazolam spray.